demonstration class, so don't expect to get a certification card that you go out and start pushing on people's chests all the time, okay? It's been my understanding that you guys have been learning a lot about the heart this last week. Who can tell me approximately how much blood's in the human body? Come on, I know you learned it.
Answer the question.
Somebody answer. How many?
4 to 6.
Well, it's more like 5 liters or 10 pints. So it's not really that much blood, but you have to remember that all that blood has oxygen in it, and the circulation of that blood goes through the heart in one direction, through the lungs, and then pumped out through the system, correct? Okay. There's been a lot of changes since 2006, a long time ago, they found that by circulating the blood through the human body, it can help the survivability rate of the person that's had a heart attack, rather than giving them mouth-to-mouth or bag valve mask or any other sort of airway. So they're concentrating really a whole lot on nothing but compressions and now for lifesavers and also for us. AED, let's see.
Have we learned about AEDs yet, or no?
We're going to talk about
No, we haven't
AEDs.
talked about anything related to CPR at all.
So basically, the way that what they found is that because there's so much blood in the human body and it's already pre-oxygenated through that process of going through your lungs and stuff, the most important thing that they could do was compressions. Because the human brain actually could survive up to 4 to 6 minutes without oxygen, and your other organs can survive that. But so they decided that if the blood's already oxygenated, that by circulating that blood, it's going to help.
Open package and remove tab.
Rookie. The survivability rate for that person climbs drastically. In fact, before they started doing compressions only without your airway management, it was like a 6% survival rate, and now they're up to almost 60% survival rate just by compressions and AED use alone. What did I just do?
Wear gloves.
Why would I do this? For their protection?
Yeah.
And mine, okay? Especially like when we walk into scenes and stuff, the most important thing that we can do, take body substance isolation protection, and depending on the call too, we will also wear goggles, we will also wear a mask, just depending on the call. If I'm going to be intubating somebody, looking down their trachea to put a tube down it, I'm certainly going to have some sort of eye protection on, because they tend to vomit.
And I even, if it's like a really bloody, messy, or pukey call, I'll even double glove, just in case one gets ripped because we're busy moving stuff. I would rather have another pair of gloves on underneath, just in case that somebody has whatever on my hands.
So what sort of liquids would be a protection source for these gloves and masks and stuff? Blood. Anything else? Vomit. How about, pardon me? Disease can be carried through any bodily fluid, which includes mucus.
Saliva.
Saliva is mucus, okay? Basically, if you get it in your eyes, is that a transmittable port?
Yep.
Certainly is. So we take complete isolation, body substance isolation. Another thing that we really strive on is scene safety. Am I going to put myself in harm's way trying to help somebody else? Doesn't really do that person any good. You know, if I'm hurt, I can't treat them, so I make sure that my scene is safe. So,
like one thing you just said is always make sure that it's safe for you. Yes, you want to help somebody, but make sure you're going to go home when you're done. That's how we look at it. Don't make it our emergency. So just because you see somebody down, make sure that there's not wires down or somebody shot them and somebody's still walking around with a gun. I mean, weird things happen. Unfortunately, they're getting weirder, but you know, always make sure that if you're going to help somebody, that you're still going home at that, you know, when you're done. Like that's how we look at it. That we go home at the end of our shift.
and I strive to teach like the new EMTs coming in and working in EMS and stuff. That's one of the first things couple first things I tell them is it's that patient's emergency, not yours. So don't go in all gung-ho, you know, they want to go, my adrenaline's rushing, let's go, go, go. Well, that's not the case, because it's their emergency, not yours. And I always tell them that if they treat every patient like you would want your own grandmother treated, then you'll do really well in the business of EMS. back to CPR. Who wants to learn it? Okay, and we used to do that, a precordial thump. We don't do that no more, okay? Like if it was a witnessed arrest, we certainly would kind of give the heart a quick jolt by doing a precordial thump, but we don't do that no more, okay? So basically, when you find somebody down, you want to, the process is, you want to shake them. Hey buddy, are you okay? And if they don't respond, the first thing you want to do is kind of get down close to them, look down their chest, see if they have any rise or fall, if they're breathing or not. And at the same time, I will feel for a carotid pulse.
And they've learned about pulses.
You guys learn about pulses?
Yeah.
And the carotid pulse and up here and stuff. So I'm checking a couple things at a time. Next thing I would do, I will yell for help. And if somebody's there, I say, go call 911 and get the AED. And then I will begin compressions right away. I don't worry about the airway or anything like that. Location of your hands, does anybody know where they might be? Bradley, besides you? Who knows what the
Chase.
xiphoid process is?
Chase knows.
Where's it at? It's at the end of the breastbone. Okay. So basically 2 fingers up. These are really big fingers, so I don't go quite as high. But about a finger and a half to 2 fingers up would be the palm of your hand. And try not to interlock your fingers, but you can overlap your hands. Okay? And typically people don't have cardiac arrest sitting on tables, so you're much lower. You're on your knees. But basically you want to put the palm of your hand in the middle. 2 inches compression. May seem like a lot. It is. And sometimes you crack ribs. But you have to crack rib or death. You have to weigh those options. They'd probably much rather be alive. 2 inches depth as fast as you can. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11, 14, 15, 16, 17, 18, 19, 20. How many times do I do that?
20.
How many?
20.
No, actually you do 100 a minute.
Oh, I think how many?
Can you imagine how fast that is and how many compressions that is? What's the average pulse rate of a human? 70. 60 to 100 is normal, is what we consider normal. So you want to circulate that blood, so that's what you want to do, 100 a minute.
And also, you gotta keep your arms, kind of lock your elbows. He can't really do it here because he's up high.
Yeah. Basically, you want to keep your shoulders over your arms and use your upper body weight, because if you try to do 100 compressions a minute like that, you're going to get tired real quick. So we're doing 100 compressions a minute for 2 minutes, okay? And then we'll check for a pulse real quick. If they don't have a pulse, you start your 200 compressions again. During that compressions, anyone ever seen one of these? What is it? Chase? Which stands for? Come on, I know you know it. Very good. Well, that's one of the words. AED is an automatic external defibrillator. Do you have any of these in your school? You do. There's 2 in the nurse's office, I think,
And the training room?
and the training. And they should probably have 1 in every building. These are really self-taught type things. I mean, they walk you through completely. So you're doing compressions. You got somebody that won't call 911. You hear the sirens in the distance, and she brings back the defibrillator. Basically, when you open this up, it automatically turns on. You may have to turn it on, depending on the style or the model that's going on. Bradley, come here.
Tear open package and remove pad.
So we're going to light him up, and he won't be out unconscious very long.
Tear open package.
So we're doing compressions. We're doing compressions. We're doing compressions, but we don't stop compressions to put the pads on.
Peel 1
Anybody know why?
plastic liner.
And
You
the
got to
stickers
keep
show
that
you-
blood
Peel 1
circulating.
pad from plastic liner.
The stickers show you
Place
where to
1
place
pad
it.
on bare upper chest.
So it'll
Place
walk.
1 pad on bare upper chest.
It might not accept, realize,
Place 1 pad on bare upper chest.
because of the short.
Peel 2nd pad and place on bare lower chest as shown.
So it's going to prompt you and walk you through it. So these are just about fault resistant.
Bare lower chest as shown. Do not touch patient.
So now at this point we would stop CPR and let the machine
Do not
analyze.
touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear.
This is only going to hurt a
Shock
little
will
bit.
be delivered in
the shock has been delivered and it analyzed that there was a shockable rhythm, because sometimes the heart can go into rhythms that are not shockable. Can go into VTAC. VTAC is a ventricular tachycardia, means that it's going really fast above 150 on the rate. The thing with can you imagine a heart pumping 150 times a minute? So that's one big muscle, and you got the 4 chambers, correct? So now it's doing this. It's kind of just sitting there quivering. It doesn't have time to fill full of blood or pump blood out. So that can be a lethal rhythm also. It can go into a AFib rhythm, which Amy has AFib.
And I melt Chelsea's mom on.
It's actually controlled by medication, so, but she has an irregular heartbeat where her atrium, which has a node in it called the pacemaker, did you guys learn that? The SA node? Okay. Has the pacemaker node, and it gets confused sometimes, because the heart works on like 3 functions. Works on automaticity, we know what that is? Just that automatic of it. It works on conductivity, which is the electrical conductions working across it, or the chemical conductions making it beat. It also works on excitability, which is the combination of the chemicals and the electrical impulses going through the heart. Well, she has an irregular heartbeat, and the bad thing about an irregular heartbeat is because that atrium on the right side doesn't pump fully all the time, it can build up blood clots. And if the blood clots break loose and go into her lungs, what can that cause? Any idea? Did you guys learn about blood clots traveling through the pulmonary system? Pulmonary embolism, very good, and that can be lethal. It can also, blood clots can travel up to your brain, which can cause strokes. Have you guys ever seen somebody with half their body didn't work the way that it should? That's probably caused from a stroke. They can have trouble speaking, they can have trouble forming their words. There's different kinds of strokes. There's hemorrhagic strokes and ischemic strokes. Ischemic strokes is from blood not getting up to that part of the brain, and brain is muscle, and if you don't have blood, you don't have oxygen, you have muscle death. Okay? And hemorrhagic strokes are somebody bangs their head and now their brain is bleeding when it shouldn't be bleeding, and it puts pressure against the brain. You guys want to try to do 200 or 100 compressions a minute and see what it's like? Or you can come up here and ask about the AED. I want you guys to get on these dummies. Find the right hand process. I'll come around and help you on it. Would any of you like to take body substance isolation? Put on a pair of gloves.
They've been putting gloves on to do the pig, so let's watch.
Remember with early notification, get 911 on the way. Early defibrillation.
That's supposed to be your quick process. So you're done a good fingers. So good 2 fingers if you have a small. You could do like 2. And then just go right over. And to make sure the key thing is to keep your arms straight. But it's hard because these are high. Short. I know, because otherwise you won't be exerting all your effort and your force this way. You'll be stretching it out and you'll be tired a whole lot quicker. And you gotta have a nice rhythmic. You can't go like real fast and then slow down.
Here, you try, Josie. I'm too short.
I did 2 breaths.